the limit of the treatment.
おそらくスウェーデンの現状が今後日本の現状になるんじゃないかな。広岡先生からご紹介いただいたジョバンニ先生、こちらにいらっしゃっております。Nice to meet you.
Nice to meet you. Welcome to Sweden again.
Thank you so much. スウェーデンで実際どうなのか、インプラント周囲炎というのは、本当に現場のトップランナー、もしくはもう本当に最先端でご活躍なさっているジョバンニ先生に今日はたっぷりとお話を聞いてですね、スウェーデンの現状、おそらくスウェーデンの現状が今後日本の現状になるんじゃないかなというふうに考えられますので、ぜひ皆さんもお楽しみに聞いていただければいいんじゃないかなというふうに思います。
To answer to your question, what we do is basically we have the same approach as in perio treatment, in the sense that first we see that the patient has a good oral hygiene and motivation, instruction. If the patient has some bridge on the implants which they are not fitting for good oral hygiene, then we modify. We try to do the subgingival scaling, but unfortunately the instruments that we have, they are not so effective. And then more and more after this stage we do the surgery because try to have a better view of the implants surface to clean it. Now we work both I and Sarah, me and Sarah, we work in this specialist clinic here. So we have a referral for this kind of treatment. So we treat a lot of peri-implant treatment because we have all the referral from the general dentist. It is about 30% of all the patients we have here in the clinic.
It's becoming a more popular treatment here to replace missing teeth. Implants more and more now. The geriatric patients, they develop peri-implantitis more.
So, yes, I work here from 20 years, and in the last years they've been increasing of referral for peri-implantitis. I have to say also that there is people, dentists in general, they are more now attent to see the implants if they're healthy or not. So it's also changed. It's more common for the dentist to try to probe around the implants if there is peri-implantitis or not.
インプラント治療の先進国といわれるスウェーデンにおいて、このインプラント周囲炎に対しての今直面している問題って何ですか？それをぜひ教えていただきたいと思います。
Yes, I have to say I started to work with peri-implantitis 20 years ago. And at that time we didn't know so much. It was very little documentation. So in these years, let's say we have more scientific background for what we do, but in the same time, so the knowledge has grown. So we know what the problem is, how to handle it. But in the same time, I have to say that we also see the limit of the treatment, because the more you do, the more you treat, the more follow-up years you have. And I personally, I check this. I have a follow-up of 10 years of patient treated for peri-implantitis, and then you see when the things start to go down. It will be after you need some time to see if your result is stable or not. But after 5 years, if it's stable, it's stable. If it's not stable, it starts to go down. After 10 years, even down. So the challenge is that more knowledge, but in the same way also knowledge at the limit of the treatment.
広岡先生はですね、このインプラント周囲炎の特に初期において非常に効果的なんじゃないかということをおっしゃっておりました。ぜひこのインプラント周囲炎、この治療器 応用は可能かどうか、その辺のちょっとお話を聞きたいなと思います。
As I told you before, we approach the peri-implantaris treatment the same way we approach the perio treatment. And then what the problem is that we don't have appropriate instruments to clean the implant surfaces because of the implant surface, which is very difficult to reach with the normal scaler, with the normal. Myself, I've been also thinking that it's needed not just a mechanical instrumentation, but also in chemical instrumentation. And I have the same concept in perio, and I think it's even more here. It's needed something that help and have adjunctive effect. What is interesting in what we saw today in the machine is that you have this chemical approach, method and physical approach, and so a combination of general when we go to mucosa and to clean these implants. Yes, so I think it's very good.
Oh, thank you very much.
We've been speaking with Ira, facing this problem, and so I think the idea is very nice.
Yes.
Because most peri-implantitis patients you have to treat with surgery.
Yeah, yes.
And with this, maybe we can skip or replace that with a non-surgical treatment. So that would be very good for the patient.
Especially in the initial, as Dr. Yoga said, in the initial stage.
Yes.
We can have.
Usually, because they've gone through surgery for the installation, they've already been through so many surgeries before, and then when they hear they need another surgery, they are not so happy for that. So it's a good alternative.
I think the initial stage one can have a good effect. When you start to have almost 50%, 60, 70, start to be very difficult to do without surgery. Sometimes you have to remove the implants. So I think it's very good to have something that can help in the early stage to avoid to go forward. And maybe can help we call the supportive therapy after one do a surgery, for example, that there is residual pocket.
でもしですか、この治療器今日このまま置いていくとしたら、先生このまま使いますか？
I will use it.
ありがとうございます。
When I do surgery, when I open and you see the surface of the implant, they are absolutely full of plaque and sometimes calculus. I don't have any problem to touch, and I mean, for me it's important to clean as much as possible. I don't have you can touch, and I do this with the ultra-use instrument brushes. So it's unfortunately it's a common thing, but it's for me in a way it's not logical. Because when you see the surface how they are, I mean, you understand it's nothing to be. It's important to clean. You have to clean the best way.
もし東北大学と一緒にね、このインプラント周囲炎の研究なんかを一緒にコラボレーションしたいなと思うんだけど、その辺どう思う？
Yes, I think we can test, and it's clear to be maybe in a protocol.
That would be very interesting.
It will be very interesting.
It's good to have every treatment modality in one machine instead of many machines.
Sure.
As well. So,
Yes.
Thank you very much.
Nice to meet you.
Thank you very much.